59 with rhinoorbital mucormycosis and the remaining 80 with pulmonary involvement. Patients were from age ranging from 10 years to late 80s, and there was a male preponderance found in the series. India was topping the list, followed by surprisingly long list of other countries like USA, France, Russia, Germany, and trailing down to countries like Brazil, Iran, and Bangladesh. There was a staggering mortality of nearly 50%. Patients coming in may present in different ways. Patient may come in with a co-infection along with COVID-19 during admission, or infection with mucormycosis may occur as a sequelae following the COVID treatment. And it also may be found in patients who have been already, who recovered from COVID. Now, what to expect as an ophthalmologist? We can find patients with either reduced vision or sudden loss of vision, ptosis, eschar, proptosis, ophthalmoplegia, hyperesthesia, orbital preseptal cellulitis, and even central retinal arterial occlusion. Other symptoms can be nasal discharge, stuffiness, heavy-headedness, history of headache or seizure. Eschar may be found in the intranasally or on the palates, and even dental pain. Now we will be walking through a few case reports to help us understand that how the condition has been dealt with practically and how it presents, so that we can roll up our sleeves and act accordingly. The first case of interest was published on 12 August 2020 in the American Journal of Emergency Medicine by Amanda Worthman. And she describes the case of a 33-year-old female with orbital compartment syndrome along with COVID, rhinoorbital cerebral mucormycosis, and DKA. This case was actually the first one which was documented of mucormycosis associated with COVID. The patient presented with acute proptosis, altered mental status, and history of fever and breathlessness for 2 days. On her chest x-ray, there were signs of pneumonia, and a CT scan of brain and orbit revealed ethmoidal sinus thickening, and then further investigations were done. Relevant investigations were done, and she was treated for diabetic ketoacidosis, COVID, and rhinoorbital mucormycosis. But sadly, after 26 days, she passed away. The author emphasized in this paper on the crucial role of compromised immunity dragged by uncontrolled diabetes, leading to diabetic ketoacidosis, making the person a prey to COVID-19 and mucor. And she also stated that early diagnosis and treatment is of vital importance to an extent that a delay of even 6 days is associated with a doubling of 30 days mortality from 35% to a staggering 66%. This was a report published in the Indian Journal of Ophthalmology in April 2021 by Shandip Sharkar, Tanmay Gokhale, and others. Here, a cluster of 10 cases were diagnosed as orbital mucormycosis with associated COVID. Following routine screening, one patient was admitted with concurrent COVID-19 and mucormycosis, while the others developed mucormycosis while being treated for COVID, when they were treated with systemic steroids, immunosuppressives such as tocilizumab, and potent antibiotics. They were all known diabetics. 4 cases had DKA on admission, and DKA flared following steroid admission in the rest. This is the table demonstrating the demography and the clinical profiles of the patients. According to this, 80% of the cases were male with age ranging from early 20s to late 60s. 6 out of 10 patients had central retinal arterial occlusion on presentation, which is according to the latest International Journal of Indian Journal of Ophthalmology guideline, falls in the stage 3C of rhinoorbital mucormycosis. They received treatment according to the National Institute of Health recommendations. Of them, 1 underwent exenteration. 4 patients expired within a month of the diagnosis. The author turned the spotlight on how the consequence of using steroids, immunosuppressors, potent antibiotics made matters worse by increasing the susceptibility of the patients to fungal infection or exacerbating a pre-existing one. And at the same time, alerted all the physicians, including ophthalmologists, to be mindful of the probability of development of the fungal disease. This was a retrospective interventional study published in the Indian Journal of Ophthalmology in February 2021 by Mritika Sen and Sumit Nain and others. The study was conducted on 6 cases to shed light on defining the demography of the population at risk, early diagnosis with typical clinical features, and necessary investigations, and also recommendations for the management of mucormycosis in patients with COVID-19. Early diagnosis could be examined by examine the visual acuity, the pupillary light reflex, ocular motility, sinus, tenderness, palatal, and nasal examination, and suggested bedside procedures such as nasal swab for KOH mount and culture. According to the report, the fungal infection were more likely to develop during the middle and later stages of the COVID infection. Even according to the clinical profile of these 6 cases, we can see that even after 30 to 42 days following the COVID infection, patients were infected with mucormycosis. The author stated the importance of regular follow-up after recovery from COVID, as most of the patients in this series developed fungal infection after recovering from COVID-19. Patient education with early warning signs such as nasal discharge or periorbital pain or sudden loss of vision should be educated. And along with that, they should be advised on how to control their comorbidities. This is a case report of rhino-orbital mucormycosis in 2 COVID patients from Iran. This was published in the European Journal of Ophthalmology earlier this year by Dr. Amir Reza and Abbas Bagheri. There are case reports pouring in from different parts of the world. There is no knowing how far and to what extent the fungal spread will go. Hence, we need to prepare ourselves. This was recently published in the Indian Journal of Ophthalmology to help ophthalmologists deal with the fungal outbreak. The guideline elaborately describes a proposed rhino-orbital cerebral mucormycosis staging and the management approach for possible, probable, and proven rhino-orbital cerebral mucormycosis. As of 26th of May 2021, 2 documented cases of COVID-19 associated with mucormycosis were detected at Bardam, and one of the 2 patients died while the other patient is still under treatment. This was taken from one of the Indian papers on 25th of May 2021. And the Health Minister of Maharashtra, Mr. Rajesh Stowe, declared black fungus, or better known as mucormycosis, as the notifiable disease after nearly 2,000 cases who were diagnosed with it and claimed the lives of nearly 25% of the patients. We need to understand the gravity of the situation, and hence we need to be fast and vigilant to catch the early signs, give advise urgent and relevant investigations, and get all the help possible to create a multidisciplinary workforce. The internists should employ judicious use of potent antibiotics, steroids, and immunosuppressives such as tocilizumab. And monitor the comorbidities and control them, especially the post-COVID patients. And we ophthalmologists should consider exenteration where required. Thank you for your patient hearing.
Thank you, Dr. Intaser Farooq, for your nice journal presentation. Thank you.